Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about PCOS. And before we get into the video, I did want to let you guys know I have a link in my bio for the new group for expectant as well as current moms, or if you are trying to conceive, definitely go ahead and check out my group. It's a great community. We are all super supportive, and I also post informational things over there as well. So definitely go over and join. Would love to see you guys over there. Anyways, let's get to the point of this video. So this video is going to be on PCOS, or polycystic ovarian syndrome. And another name for it that is more accurate is going to be hyperandrogenic anovulation. That's a huge mouthful, but it is more accurate than PCOS because PCOS stands for polycystic ovarian syndrome. And if we break down the name of that, it implies that there are multiple cysts on the ovary, when in fact they're actually follicles that are in multiple numbers, not cysts. Versus if we break down the actual more accurate name for it, which is hyperandrogenic, which means an excess of the androgenic hormone, and ovulation, which means that you are not ovulating. That is actually a more accurate term for what is happening when you have PCOS. But basically, what you can think of the syndrome as being is just an excess of the male sex hormone being produced by the ovaries. So, an excess in the androgenic hormones are being produced by your ovaries. When there should only be a little amount produced, there's actually an excess of it. This does end up causing issues for women, including infertility as well as increased hair growth. And in order to be diagnosed with PCOS, you do need to meet 2 to 3 criteria that I am going to talk about, as well as we have to rule out that you don't have any other syndromes that may be mimicking the symptoms that you would have with PCOS, like Cushing syndrome. And the 3 criteria that your doctor is going to look at is number 1, do you have ovarian dysfunction, which means that you have irregular periods that are coming less often than what is expected, or you don't have a period at all. Number 2, clinical or biochemical signs that you have been secreting more androgens than usual. So either that is going to be done through a blood test, which is going to give you a biochemical sign, and they're going to look at the actual androgen levels in your blood, or clinical signs such as the hair growth that I was talking about earlier on in this video. And the third criteria would be to see on ultrasound if your ovaries have a PCOS appearance, which I will talk about later on in this video. So basically, you need 2 out of these 3 criteria to be met for your doctor to diagnose you with PCOS. And therefore, ultrasound actually isn't really even needed to diagnose somebody with PCOS. And the funny thing is, somebody with PCOS doesn't necessarily display ovaries that are going to be classic of what we would expect to see with a PCOS diagnosis. As well as somebody who does not have PCOS, sometimes their ovaries look as expected with what it would be with somebody who has PCOS. So that's why only 2 out of the 3 criteria do need to be met, and ultrasound doesn't necessarily need to be part of that diagnosis. And PCOS is actually pretty common in women. The estimates show about 8 to 13% of women are affected, and up to 20% of women are affected, depending on the diagnosis criteria that you are looking at. So that is a lot of women being affected by this. And because the ovary is producing so many follicles, but a lot of the time there is no ovulation that is occurring, and there isn't that dominant follicle that is being produced or released, these women do have a hard time becoming pregnant, or even when they do get pregnant, there is recurrent miscarriages, as well as there is a long-term increased risk of conditions such as type 2 diabetes, as well as heart issues. And these women also tend to be more susceptible to having an increased rate of depression as well as anxiety. And the classic clinical presentation of somebody with PCOS is going to be number 1, those oligo periods, or in other terms, having a period much less than what you would expect, so it doesn't come every month, or you don't have a period at all. Number 2, having dark hair growth on places that women usually don't have excess hair growth that is dark, such as your chest and your face. And number 3, obesity. So those are the 3 classic signs that somebody may have PCOS. And although that is the classic triad that is usually presented for those who have PCOS, you can also experience infertility as well as alopecia and increased acne. The cause of PCOS is unknown, but if you have type 2 diabetes or you have a family history of women in your family having PCOS, then your risk does increase of yourself having PCOS. There's also no cure for PCOS, but for some, a change in lifestyle may help their symptoms, such as a change in diet as well as exercise. And for others that are experiencing the infertility side of things, ovulation induction medication or fertility meds in general may have to be used in order to induce that ovulation that many women with PCOS don't actually end up happening on their own naturally. So on ultrasound, the classic presentation of somebody who has PCOS is going to be enlarged ovaries as well as an increased number of follicles in each ovary. Now, it's important to note that when we are assessing somebody with PCOS, the best way to do it is through an internal exam so that we can actually get an accurate count of the ovaries as well as the ovarian volume. And if you have had your period, so the start of your period was less than 8 years ago, we can't really diagnose you with PCOS via ultrasound because of the fact that women who have just started their period or are in that first 8 years of their period, they tend to have an increased number of follicles in the first place. So, therefore, it's not really a reliable indicator if you've only just started your period or if you have had your period for less than 8 years from the onset of it. Anyways, so this is an ovary up here that is enlarged. The volume of the ovary does need to be over 10 cc's or 10 milliliters, and that is a measurement that we do in 3 planes to get an ovarian volume. And this is also a classic string of pearls appearance. So what that means is these like circular dark areas all around the ovary here. They are all along the periphery, and we call that a string of pearls appearance. But that doesn't have to be present in order for us to say these ovaries do look like they have PCOS. Basically, what we are going to do is measure the volume of them as well as count these dark circles. So these are actually follicles on the ovary here. And we need to see if there are over 20 follicles, as well as ensure there is no dominant follicle or no cysts on the ovary. So in a normal ovary, these little dark areas here are going to be present, but there's not going to be so many of them. So there should be under 20 of them, as well as one of these should develop into a dominant follicle every month. So one of these big black areas should be larger than the others because an egg is going to be released from that dominant follicle. Again, many women with PCOS do not develop a dominant follicle every month. Therefore, they are not going to have one of these follicles be bigger than the other. And also, this does affect fertility. With all of that being said, though, I have scanned many patients who have been diagnosed with PCOS who go on to have pregnancies without issues. So there is hope. Just because you have PCOS does not mean you will for sure be infertile. And here's an example of us counting follicles on ovaries. So these 4 pictures here are all of the same ovary. So you can see they're starting from this picture over here, and then they're moving all along. You can see them counting all the follicles in the ovary here. And we are doing this by just sweeping through the ovary, and either we are taking a clip through it and counting them after the fact, or we are doing still images such as what they are doing here of each plane or each section in the ovary and then counting each follicle from there and adding them up afterwards. Hopefully this video has been helpful for anybody who maybe thinks that they have PCOS. And how this relates back to my page and pregnancy is the fact that PCOS is one of the leading causes of infertility because, again, there's all these little follicles that are on your ovary, but most of the time they don't develop to a dominant follicle and therefore you do not ovulate. But again, if you are diagnosed with PCOS, this doesn't mean that you cannot have a pregnancy. This doesn't mean that you can't have a healthy pregnancy. It is just good to be aware of your diagnosis so that your doctor knows to take the appropriate steps. And you may need things such as fertility medication in order to be able to make this happen, but that is not always the case.